Hello, my name is Dr. Casey Hammett. I worked on this project with Dr. Kathy Nguyen and Dr. Ryan McKendry. Our project is called Assessing Resident Comfort with OMM. The goal of this project is to eventually increase resident comfort and fluency with OMT to support the use in clinic and in our future practices as family medicine doctors. It's been found that residents who receive ample OMT training in residency are more likely to use in clinical practice afterwards. Our current goal is to assess the comfort of our current residents, and then eventually we will implement meetings where residents can practice and discuss OMT with their peers to improve this comfortability. The goal of phase one of this project is to simply assess if there is any interest in the current family medicine residency program for these meetings and to determine the perceived weaknesses and strengths regarding diagnosis of treatment with OMT. That information will eventually be used to design the aforementioned meetings and practices. A survey was sent out to the family medicine residents and attendings, where a scale from 1 to 5 was used to assess the strength and comfort with OMT and interest in extracurricular meetings. The decision to include attendings was made due to attendings commenting that they also wanted more opportunities to continue to strengthen their OMT outside of their clinic visits. The survey included some open-ended questions to give opportunities for the residents and attendings to tell us about the barriers they personally have encountered to performing OMT in the family medicine clinic and what they would be interested in learning if applicable. Overall, our outcomes showed that the PGY1 and PGY2 residents were less comfortable with both diagnosis and treatment than the PGY3 residents. While this is not surprising, it does indicate there is room to help the PGY1 and 2 residents with their comfort, which would be the goal of our eventual meetings. Likewise, it shows that the PGY3 residents had little to no interest in these extracurricular meetings, while the attendings had significant interest, with 100% of the respondents saying they would be interested. Our data demonstrated that of the residents and attendings who responded, a large number were interested in meetings to discuss and practice OMT. It showed us that PGY1 and PGY2 residents are more uncomfortable using OMT and that their perceived weaknesses are overwhelmingly cranial and HVLA, though there are still several other techniques such as FPR, STIL, and BLT where residents were fairly evenly split in terms of comfortable and uncomfortable, indicating there's still a lot of room for growth and improvement. We plan to conduct a new survey at the beginning of the 2026-2027 academic year to reassess comfort and experience across all classes, including the incoming intern class. We'll use this data to compare before and after the interventional meetings to determine if these meetings can truly improve resident comfort earlier in residency than PGY3 year. Ideally, the curriculum would target the PGY1s and 2s. However, there is a potential to help the PGY3 residents with preparation for the AOBFP board exams. Thank you very much for your time, and thank you to Dr. Miller and Dr. David for their help with this project.